Yeah, so welcome everybody to this meeting. This is for us living in the northern hemisphere on this planet is the beginning after summer pause. So I hope you are rested. This is the first meeting after July and August pause. And it's a very interesting theme, absolutely essential, something that will help us as mindfulness professionals, to be more supported within the texture of society. So how we can support that the MBI, so mindful-based intervention, can be supported from the healthcare system. For some countries, this is already a reality. So we have someone from Germany, Tatini Petra-Schmidt, who will share about her experience or the experience in her country. Then we have Sarah Jane, who has really promoted this meeting. Sarah Jane from Ireland. But we have, as you can see, different members. And this meeting is emanating for this intention within the AMBA exchange so that members support other members. This is really part of our spirit, of our DNA, how we can support each other. And so here we are, and we will structure the meeting in this way. So Sarah Jane will share what she has prepared for 10 minutes, and then Tatini will continue, and there is space for Q&A, or you can share what's happening in your own country. So we go with the flow. We see how the conversation and the sharing will guide us in different directions. So we are here to support each other again in the spirit of Yamba. So thank you very much. And I thank you also the colleague, Katerina, and other board member that are here with us. So Sarah Jane, when you wish, you can unmute and you can start sharing.
Thank you so much, Teresa. And yeah, and thank you to you and Katerina and to Tini for hosting this conversation. It's been something that's quite live for us for the last while, and it's lovely to see other members as well here from Ireland. We were sharing it in the last week to invite people to engage, because we're very much figuring this out and coming to this conversation mostly with questions more than answers, because we've been working on this for a while, and it's challenging. It's challenging to make headway with this. So really open to understanding other associations and countries' experiences of how they're doing it, not wanting to reinvent the wheel, and learn from other people's learnings and mistakes and successes as well. So, and Tatini has already as well been very generous with her time in sharing some of their experiences in Germany with us, which we are trying to put into practice here as well. So it's great to have a space to share what we're learning as we're going with this as well. Yeah, and so that's what kind of prompted this evening, is us as an association in Ireland basically trying to work towards recognition, not just and reimbursement, not just in the private health insurance space, but also in our public national healthcare system, which is called the HSE, the Health Service Executive in Ireland, so that it's about as much about it being a financially viable profession and livelihood for our members and teachers as well, and offering something that can be of value to population health, and to provide a public good. Um, but yeah, so that it's so we're exploring that, but also that it's accessible. So I think that's it's as much about reimbursement for teachers as also making what MBIs and what our members are trained to deliver accessible to people that need them, that may not even have the financial resources to do it on a private basis. So we're exploring all avenues on that as well within our national public healthcare system as well. So there's lots of different streams coming from this. Um, and it's quite complex. So I'll give you a little bit of background about the MTAI and our Irish Association, but I'm conscious as well we have some members here from Ireland as well. So it'd be lovely as well if anyone, in terms of the context that I'm providing, if there's anything that I've missed or anything else that anybody else wants to add, please bring it in later, we'd be delighted to add more to that picture. I'll do my best to set the scene. So we are a formal association since 2018. So that's about 7 years. But the network of mindfulness teachers in Ireland began about 9 years before 2018, about 2009, where teachers who were all training abroad because there was no teacher training within Ireland at that time, were coming together to support each other by inviting international teachers over to Ireland to hold annual retreats, CPD and training days, etc. And then that grew from, which I'm sure is the case for a lot of the associations, grew from a lovely community of practice into a formal professional association that had its own legal constitution in 2018 and became a non-profit organization. So we have in and around 200 members, and we've over 100 members who are full members, who are teaching, who are insured, who are, doing CPD and supervised, etc., and are active members. And we also have associate and student members as well. So um, it's quite an active community, and we have a lot of teachers coming from different professional and training qualifications and training pathways. Um, as part of our support for that, we provide, as an association, we provide 2 in-person annual weekend retreats every year for people to come together. We provide some different CPD training and days. We provide connection mornings to allow people to have a chance to come together online and in person. And like I imagine many of the associations are, maybe most, we're also run, which is very important for this work as well, for the context of that, we're also run by volunteers. So we have a board of 8 members of directors, and all of whom are volunteers. We have 3 subcommittees: supervision, standards, and membership, all of whom are volunteers. And basically that's what keeps us going, but it also means that we're limited in sometimes in terms of time and energy in what we can do, but we keep going. Our members, as I imagine is the case again for a lot of the associations, what we're trying to get a sense of is what our members are doing, and that's always evolving, particularly after the pandemic as well and the move to online teaching. We have a lot of members who are offering 8-week public like the standard MBIs, 8-week courses available to the public in their communities or online that are available throughout Ireland and even further afield. We have members who are delivering 8-week courses within particular contexts like prisons, hospitals, schools, cancer care centres, and lots of different contexts. And we have lots of members who are delivering adaptations of the MBIs that we would be trained to deliver in their own professions, and others who are just weaving it into what they do. We have a lot of therapists as well who are members, who are weaving it into their therapy work. There's huge variation in the membership between those from those who were teaching formal MBIs to those who were weaving it throughout their work in many ways with clients, patients, etc. So there's lots of different ways, and there's which also informs the conversation around how our work is recognized, how our members are recognized as well, because a lot of members are doing a lot of different things. And of course, some of that as well is that people who are members who are qualified as well would like to be teaching more MBIs, but can't afford to because they can't fill the spaces. We have seen in recent years issues around courses being cancelled because the spaces aren't being filled, particularly when you have overheads of, advertising, of booking rooms, etc., and paying, professional fees and all the different things that we do. So that's an issue in terms of our members being able to continue practicing and not having to subsidize that with other work if that's what they want to do. So we were talking before the call about the new curriculum, and Katerina talked about John Kabat-Zinn talking about teaching mindfulness should be a right livelihood, and I suppose that's a big part of what we're working towards, is that MBIs have such a huge impact on individual health and potentially population health, and it should also be able to provide right livelihood for our members in an ideal world. And that is proving to be a challenge in recent years, if we're being very honest. So in terms of the recognition work that we've been doing, it's been ongoing since we began in around 2018 with previous boards where they would have approached health insurers, etc., and different stakeholders within our National Healthcare Service. That didn't, as far as we know, that didn't really go anywhere. A lot of the health insurers at the time were more drawn to recognizing app subscriptions such as Calm and Headspace. And in the last year, we've done a review. We only have, I think, three, and there might be four, main health insurers in Ireland. And the way they cover mindfulness at the moment is predominantly reimbursement on your app subscription to Calm or Headspace. Or you can take a course on mindfulness that's in these course where you can put in a search, but it wouldn't be by mindfulness teachers. Now, our members can put their courses up on that, but there are loads of other mindfulness courses as well that range. They wouldn't be recognized MBIs. So there's a lot of variation in what is recognized, and it tends to be more on the app end at the moment in terms of our health insurance providers in Ireland. We are trying to take a bit of a more targeted approach in the last year or so, with a bit of talking to Tatini a bit more, what she described as a task force who's come together. We have members who are working across, who are, qualified mindfulness teachers, but also working in the healthcare system, either as general practitioners, physicians, as psychiatrists, as psychotherapists, and working within either the public or private healthcare service, and have a better sense of where there are opportunities for how the MBIs would fit within those services. So we're trying to take a bit of a more targeted approach to find out who are the stakeholders and policymakers and decision makers that we need to speak to have this work valued and recognised within the Irish healthcare system. In the last year, that has taken the form of many emails going out, some meetings, but it's proving very, very difficult to get actual physical meetings or even online meetings with anybody that we want to speak to. So that's a major issue at the moment. We have is just trying to get a bit of face time to really show the evidence and the cost effectiveness and all the benefits of what our members offer and the value of MBIs, and to present case studies from places like Germany and other places further afield like Singapore that are recognizing these programs and reimbursing their members for them. Some of the challenges that we're faced with is, I suppose it's that what we've named is that kind of competing with other offerings that have different financial models and different profit incentives as well, and competing with apps and shorter offerings that are cheaper, shorter, and maybe kind of mindfulness with kind of a tag on different things as well. So and a lack of understanding of what MBIs are, why it's so important to have qualified teachers, etc., and ethical standards. It's also there. We've also have the issue, which I think is very common across most associations, is that there's only so much time as well that people have in their voluntary efforts of seeking out this recognition. We don't have marketing teams and sales forces, etc., to go out and do this. So we're all trying to do it and find these meetings. One thing we have done that we are in the process of doing is joining a mental health reform coalition that is in existence within Ireland, which is many non-profit groups that come together to lobby basically the Irish government in advance of budget considerations when they're making their annual budget decisions about what to basically apply public funding for, particularly around mental health services. So we're trying to basically start now to network with different groups who have experience in lobbying efforts and advocacy efforts of actually influencing policy and practice and public funding around mental health reform and different services within the healthcare system. The other avenue that we're looking at as well is around, we have a huge waiting list as well in Ireland for those who go to their doctor with and they're suffering with maybe depression or anxiety, and they're referred to a service within Ireland for one-to-one therapy. They're very, very, very long waiting lists and that. So we're trying to work with people working in that space as well to see if MBIs can be offered in the interim while they're waiting for one-to-one and can be available to them afterwards, so that there's more of a menu of options while people are on these long waiting lists. So there are some of the things that we're doing, but again, we're really, really wanting to find out from other associations how best to do this and how best to kind of package the evidence and the things that Katerina shared on the outline of this evening, that the research that's coming from the US is really helpful from that. So there's lots of opportunities, I think, from seeing that research come out in terms of showcasing the benefits of MBIs in terms of their effectiveness in relation to other methods, and seeing some other case studies from other countries, such as what Tini is going to talk about in Germany. So I think that's kind of it, just to set the scene from Ireland's perspective, and people can ask questions, and maybe some of the other people here from Ireland as well might have something to add to that, that might help clarify anything. But yeah, I think that's probably it from me. So thank you for listening.
Thank you, Sarah Jane. I was taking notes. Thank you for your generous sharing. And yeah, maybe I will later, after hearing what Tatini is sharing. But so in the wider spectrum is just understanding the scene. I mean, your local situation, how the competition with cheaper solutions is an issue, and how the weaving is happening within the context. But your intention is really to create a package that is showing, the evidence of these interventions, showcasing other countries, and after that, maybe my question would be how much evidence is needed for the training of the teachers. This is also another thing that maybe also in Germany is something that have somehow sorted out in some ways. So thank you so much. And I pass it to Tatini. So please, and then we come back together. Thank you so much for sharing.
Yeah, thank you, and apologies for being late. I had a patient and there was kind of some urgency, so I could not come earlier. Yeah, nice to meet you. Nice to meet you again, Sarah Jane. We didn't have the time, unfortunately, to speak before, but I guess for sure we will have time within the next weeks or so to exchange again and to continue our conversation, which we are continuing today. And I remember that we met almost like 1 year ago. And yeah, so I went through all kinds of documents today together with the support of my association. And I prepared two things, and I would like to share my screen to share how the process in Germany went and how it is right now. So I'm sharing my screen now. Just a moment. How to obtain, okay. Yeah, and of course, I would like to provide you with all the documents I'm showing now. You can translate them if you wish. So, and I've translated quite a bit already for this evening. So, let's see. Okay. So can you all see and hear me well? Okay. So how to obtain recognition for MBIs in Germany? So there is a statutory health insurance fund, GKV, and it commissions a neutral prevention assessment body, the ZPP, to implement a certification process so that course participants, those with statutory health insurance, not with private insurances, receive a subsidy of up to 90 euros if they take a course with a listed MBI teacher. No? And what that means, I will tell you later. Right. So there are quite some documents required for the assessment of courses and concepts in order to initiate an assessment. And the following documents are required. So lesson plans, and I will hand over the lesson plans to you so you can translate them. There are many documents you can really use if it's helpful for you. And then the participant documents, the handouts, the specification of the field of action and prevention principles, the number of units, the duration per units, the selection of course instructor, then the course title, course description, group size, compact offer, description of the target group, then the gender, the age group, the age range, so it's quite specific, and then the aim of the course content with the key points, the course method, the key points described in the methodological and didactic approach, the course fee, accessibility, room equipment, portfolio publication. It's really a lot you have to prepare in order to have your course listed there and in this online forum ZPP. And to initiate a review request for a concept, then there are more documents required, hourly schedules, participants' documents, sample instructions. So, and furthermore, also some more information must be entered: specification of the field of action, the number of units, duration, the concept title, description, group size, again, compact offer, description of the target groups, gender, age group, age range, objectives, content, method, and in addition, the lesson plans, curriculum, and the participant handbook. So what first one needs to do in Germany is to have the course evaluated by this central ZPP, and only when they make an approval, they say, okay, this course is evaluated, and we say yes. Then you as a person, as an MBSR teacher, also need to be assessed. And that is a whole second journey, and the second journey also consists of 2 stages. And maybe a personal note, I was listed there. I'm from my original background, I'm a nurse and a health practitioner, and then an MBSR teacher. And I was listed in 2011, and then due to the government change here in Germany, I was delisted again. I went off the list again because with the government change, only MBSR teachers who have studied medicine or pedagogic then could be listed there. And I'm sharing my screen again for the second presentation. So, oops, just a moment, back. So then after the program got listed, the German Association began gradually certifying 4 different MBSR programs within the statutory health insurance. And that is the 8-week MBSR live course, the 8-week MBSR online course, and then the 6-day MBSR compact course, and an 8-week course Mindful Working. And these programs are listed now. And then they implemented a certification process so that course participants receive, this is what I said already, with the teacher listed there. So, and then the ZBP defines certain categories, for instance, individual behavior related categories, such as nutritional counseling and all kinds of other things. And MBSR is listed under the category of multimodal stress and resource management. So what does it contain? It contains instrumental stress and resource management, self-management skills, then cognitive stress and resource management, cognitive flexibility, for instance, and palliative regenerate stress and resource management, for instance, relaxation management. And this certification process of the MBSR teachers consists of 2 steps. First steps, an MBSR teacher is certified as a provider of prevention courses, and then unfortunately the qualifications have become increasingly stringent. Genau, what I said, 2008, nurses, physiotherapists were still eligible, and then only teachers, doctors, psychologists, and today only doctors and psychologists. So beside the course concept that must be submitted and will be certified, is already certified, those 4. And here the association works closely with its members. It had the 4 courses concept relating to MBSR certified, and issues certificates which are confirming that the member is familiar with those 4 course concepts and follow them to its members, and then they can submit them to the ZBP. So what I said already, whenever there has been a change of government, we had more or less opportunities. At the moment, we have more opportunities again, because the German association started a discussion with the GKV body, and right now the University of Darmstadt is working on enabling MBSR teachers who do not have a degree to obtain further qualifications, so they can be listed with the ZBP. Oops. And now I'm showing you what I have. This is what I have sent to you, dear Sarah Jane, right? Wait. It's a long thing. Yeah, it has 172 pages. It is in German, and it defines the criteria to how to basically get listed there. And then there is also some help. This is a document to support teachers who would like to be listed there. And this is what I can, this is basically the hours, and it's basically one part of the MBSR curriculum. It's very detailed. It's all the units with the minutes, etc. So I could provide you with this, and you can translate it for yourself. And this is the conceptual frame of the 8-week MBSR course. It's also very detailed, with also the resources of the the how you say, of the science of mindfulness, and this is the handbook. But I guess you have it. Of course, you have it for yourself, for your participants. So, in summary, it's really German, isn't it? And it works. And it works, but unfortunately, less and less people got listed there, and now also with the change of the government again, there is it's been put on a break, on a pause. But the last conversation was taking place in February, and now with the change of the government. Most probably, and now, of course, much more money goes into defense and all kinds of other things. So not so much money went into the whole healthcare system. It's not so much as as it was expected. And yeah.
Thank you so much, Satini. Yeah, indeed. Seems, yeah, that's quite a complex assessment process. However, my curiosity goes in the direction of how did you get there? There has been a process. When I was studying in the UK, and we have here Susan from the UK, I remember saying, the teacher saying, for us to get into the health system, we needed mindfulness to become an academic discipline, so that the government listens first. So was that also the path for Germany, so that it became an evidence-based discipline before the government or the health system can listen to that, and then we go into the assessment process. Who is teaching what? How that happened in Germany? What was?
I can't really say how that happened. I was talking again to my colleagues this morning, and the one who started it. It was actually Günther.
Mm-hmm.
Yeah, it was actually Günther, and what I could do is to schedule like a short interview with him.
Yeah.
How it actually all started. Unfortunately, the people were not available to talk with me before.
Sure. Thank you. Yeah, because, for example, one colleague from France today in the meeting, she was sharing the difficulties that France has to allow mindfulness to come out from the box of being something religious. So it will never be financed or reimbursed because it goes in another box. And that is then difficult. So I see that the scope is narrowing also in Germany. Just certain professionals can have access to that, can be assessed to start with. Yeah, so I'm here, opening the space now in the wider community here for those that are present from different countries. What's happening? As I said, there was also something I was trying personally here in Portugal that there is a university at least that is educating mindfulness teachers, so that they have, let's say, the stamp from a university, so that the government can be open to listen to someone who is trained in a university. So to get that credibility, it's something that seems to be necessary. And probably, there in Germany there was a key person that was opening the space, and it's probably something that is needed everywhere, I guess. So I don't know. The space is open. You can ask questions. You can share your doubts, your curiosity. And you can just raise your hand, or you can even write in the chat. Maybe what is your reality in your country? Yeah, Susan, please unmute yourself and you can share.
Hi, hi everyone. Nice to be here. So I'm also a non-clinical MBCT teacher, and I have a master's in mindfulness-based cognitive therapy. but I'm a relatively new teacher. I've been training for many years, but kind of only just feel ready to teach in the last year. And I am with my CIC, so that's a not-for-profit structure. I've been delivering mindfulness via social prescribing, NHS social prescribing, which is, I guess, for the easiest way to describe it is it's a non-clinical vehicle for preventative mental health care that is certainly in place and is a key part of UK NHS strategy. And I had a quick look, had a quick Google. I see that there's a reference to it in Ireland. And I've seen some reference to it in the US, but I'm not sure how widespread it is. And obviously it will be implemented quite differently. But what that allows me to do is to teach mindfulness and in the community. So I live and work in an area that has multiple areas of deprivation and different areas of community need. I would say the people that I work with, they are subclinical, and I'm not taking any clinical responsibility, but I would say that there is complexity and intersectionality of identity. So people have had previous mental health history, poverty, education challenges, and things like this. And there needs to be an understanding of it, like for teaching, there needs to be an understanding of that. Even though I'm not clinical, I really feel the benefit of like the solidity of my training and the ethical frameworks and the knowledge of like the window of tolerance and trauma-informed teaching. And I really heavily sort of rely on that. And I'm curious about the possibilities for social prescribing because as you were sort of saying, Petra, and yourself, Sarah Jane, as well, the systems in the UK or England where I am, so there's almost like a misalignment between even like the great quality of training that I have, it just doesn't match up with like the NHS system. It's almost like two different systems and the input does not match up. And I think that's quite hard, unless you're at a very strategic level, that's quite hard to change. So for example, in England, if say it was a talking therapy, then you're instantly in the realms of needing to be a trained, probably CBT therapist. And there are NHS roles that are CBT therapists. There is absolutely no way that I would ever be able to apply for one of those roles because I won't even, I'm not, the criteria is just not, I'm not ticking that box that is necessary to be in that role. And I would say that, again, I don't know how widespread this is as a model across Europe or how applicable it is, but in England, certainly the way, even though we have like this central NHS, the way that things are funded and delivered is very devolved and separated. So you have like, we'll have a trust in my area, which is Northamptonshire, and they have like their central funding and they're kind of delivering services in a way that's right for the area of like Northamptonshire, with some central standardization about roles and things like that. And I sort of personally, so I've been around the mindfulness world, if you like, since 2008 as a participant and as a teacher. And I suppose I've had cause just to observe the changes in the field and also just to understand a little bit about how processes work. So I think that's where I'm sort of forming these observations from. And then when I was setting up my CIC, I kind of knew I was going to aim myself in a very boundaried way at preventative mental health care, which is where I sort of aim my business. And because of like the thorough training I've had, I'm very clear about what that means. I don't offer therapeutic processing. I'm very clear about screening and things like that. And yeah, and I've just written, I can't share it yet. Hopefully I'll sort of get permission to share it from my local social prescribing scheme, but I've just written a case study just because I've been working for about 10 months. So really new, very new teacher, but just thinking that, feeling that maybe those observations must apply probably to other areas. And I will say as well, and this is quite hard to say, especially as someone, you know, my first mindfulness book was called Catastrophe Living and MBSR, even though I've trained in MBCT. The 8-week course is like, you know, a sacred vehicle. But the reality is that the first time I sat down with my social prescribing link worker and I took her through all the evidence and all the lovely curriculums, and the reality is that 8-week courses are quite hard for participants, and it's not just like, oh, they're hard and they need a bit of a chivvy up to come, like life circumstances, chronic pain, and like I was talking about intersectionality of, so we get a lot of chronic pain and medical appointments and caring responsibilities kind of mean that an 8-week course where it's a regular time homework commitment are actually out of reach. And then from a funding perspective, if you get a high dropout rate, it's very hard to justify, because link workers are in turn justifying their spend back to funders. And I actually think that a knowledge of that ecosystem and that infrastructure is very, very helpful, because instead of kind of going, oh my gosh, why am I not filling courses and things like that, you start to have an understanding of the waters that you're swimming around. And I started off by delivering the 3-week Introducing Mindfulness course, which is a relatively new MBCT curriculum. But even that had even in 3 weeks, that had fluctuating attendance. So actually we moved to a monthly delivery of one-off sessions, and actually I create one-off sessions that are taken or sourced. I don't call it MBCT because it's not MBCT and it's not even a mindfulness-based program, but in my mind it's kind of informed by MBCT because I'm looking at the themes. So like the first session I might run is like steadiness and grounding, and we'll do an anchoring practice and we'll learn about window of tolerance and dysregulation at the start, and it will be grounding. Practices will be short, like so 10 minutes and things like that. And then in another session we might do a gratitude session. So I'm kind of looking to that rich, we've got so many years of like, you know, rich material to draw from, so I'm drawing on it. And yeah, and then it actually, I have people that have come in social prescribing, we've done like 4 sessions over 4 months, and participants that have come to all of them and sort of say, well, yes, I do this at home now, which I find really interesting, because in an 8-week course, sometimes people do no homework, and it feels quite, as a teacher, I would say as well, it feels quite nice to deliver. Feels quite, I don't know what the right word is to say, but it feels quite soothing. It's quite steady, or don't put too much in the sessions. And yeah, that's kind of, and I kind of feel, when I saw the topic, I was so drawn to like come, because it just to learn, and also like sort of feeling that, you know, maybe other people are doing this sort of adaptation. It's not, you know, the first thing a lot of people say is it's not mindful, you know, you're not teaching a mindfulness-based program, and which it isn't, obviously, but also like it is sort of responding to a need. And I sort of feel kind of, I do feel like there's multiple strands to this, the, you know, the future of mindfulness and its progression, and I sort of feel like this is one of the strands, is like the more and differentiated ways of teaching, and different and broader. And I'm going to stop talking, but yeah, thank you.
Thank you, Susan, for your very personal sharing and your personal experience. But I wonder, for everybody, even in Germany, are there prescriptions? So how is a person or a participant coming to you? You said that there is, you know, also for Germany, who comes to these courses that are listed? So maybe Tatini, you can also say how is a participant coming and has that reimbursement? Is there a medical prescription?
No, it is not. It's not a medical prescription. The person is coming to the teacher, and then after the course, they get Bestätigung, you
Yeah,
know.
like yeah, a
Yeah,
confirmation that they participated in the course and stuff.
exactly. And with this, they go to their insurance, and then they get reimbursed.
Right, great. So the initiative comes from the participant. I think that the UK, for example, MBCT, if you had 3 crises, depression crisis, you get prescribed. You get the prescription for MBCT as far as I can remember. So there are, so it seems that in Germany, the path is different. The participants can decide. And this is not is different. It's not coming from the top, right? Yeah, that's a different. Yeah.
Unfortunately, actually, no, a prescription would be the best, no, but yeah, no.
Yeah, thank you so much. Yeah, I can shortly share what I'm doing here in Portugal, and is quite incredible because I was part of a European project for 3 years in which it was about introducing mindfulness in universities in the, to help students navigate their stress, their complicated life for sure. And because I was part of that project, so what I'm also, because I have an academic background in teaching mindfulness, I came as a support to psychologists. So and this is not a non-clinical setting. I'm not a clinical psychologist. I have a pedagogy background, and then I have the master. And then these are students and people, co-worker in university, which are in a clinical somehow, yeah, path. And the psychologist suggests to attend these 6 or 8 sessions with a mindfulness teacher about psychological education. And so we work parallel because the couple of psychologists that were attending these classes during the European project, they understood that they don't have such competencies. And so they opened the door to someone that has different training, that has different competencies. And so it's a parallel work. I would say that is a quite unique case just because I was part of this project. I don't think that in a different way that would have been possible. Just to say that sometimes I have the feeling, like also like Susan was sharing, that it's about the context, the people you meet. Like in Germany's Gunther, that was maybe, as I said, someone who had the right connections. I don't know. It's just it seems to be the flourishing is coming a bit as well from personal conditions. Being in the right place with the right baggage, preparation somehow, competence. So it requires a lot of faith and trust somewhere, right? That is, yeah, there is a collective effort, but also is so focused on who we meet as teachers and maybe as professionals, as psychologists or GP and so on. So that's my personal feeling, and I open again the space for other to share their personal, maybe be contained so that we can give space to others. Welcome Sheena as well from Ireland. Hi. So I don't know if there is from Belgium, maybe. I don't want to put you under the spotlight, but are there other experiences that can be shared in this circle or personal reflections? I don't see anybody else. Yeah, hi, welcome.
Yes,
Are you
sorry
from
for my
in
English. I'm from Belgium, so I'm not so good with English, but I will try to give some information. I don't have the full context, but what I can say is that the medical assurance, some medical assurance can give money back, a part of the price of the program, depending of the medical assurance. because we have a different type of assurance, and depending the one that you choose. And they put it like in alternative therapy, like sophrology, but it can be other, yes, Chinese medicine or things like this. So depending of the medical assurance, and it's a part, so around, it's in general, they can say around, for example, 120 euro for the year, or cover. Or they can say it's for it will be like 80 euro percent of the price of the program, and that the people have to follow for MBCT, MBSR, the 8 sessions, and the facilitator has to be certified by like official school, like university, like yes, some association who are recognized by the country. And then the participant ask to the facilitator the certificate at the end of the course. So some teacher will directly speak to the participants to ask the personal information to write on the certificate. And for some teacher, they don't ask, and they wait that it's the people, the participant, who ask for this certificate that after they have to give to the medical assurance. Yes.
Thank you so much.
With pleasure.
I don't know, Katerina, you are also in Belgium partly. Would you like to come in there? As it seems like, what I hear, Megan, that mindfulness has reached the possibility to fall under the umbrella of alternative modalities like acupuncture, or it has reached that status. Do you remember? Do you know somehow how that happened? I don't know, just the question, or it just the reality?
This is good question. Maybe Katarina have the answer. Honestly, me, I don't know. But what I can say, it's like for with the year, there are some practice who are after recognized. So I suppose that, of course, the science information, the fact that the practice is recognized by science, it's helpful. But no, I don't know exactly who bring that to. But it's not really the government for us, because it's like I say, it's the medical assurance. So yes, I don't know. I suppose it's a choice from the medical assurance. For example, me, the one that I have, I know when I was participant, it's they cover like 80 euros, something like this.
Mhm.
But the last group that I made, no one had a assurance who cover it. So it's
Yeah.
really depending of the maybe politic, if I can say like this, of the medical assurance. We have like socialist medical assurance. We have like the name is Christian as medical assurance. Another one, it's more private. It's so yes, it's really depending of the politic, the approach of the assurance. But maybe Katarina will complete better.
Yeah.
Yeah.
So you're saying that it's not the national assurance, health system.
No.
Okay.
Isn't, no.
Thank you so much. Katerina, please.
Yes, the country is much smaller than Germany, but it has still the division of the columns in insurances. I assume, Megan, that you're from the French-speaking part.
How
Correct?
how do you know that?
Just guessing from your answers, but also from the warmth of your voice. So here we go. This is what some of you already said. It is very often coincidence what happens. And in Belgium, not only do they have different health insurances for a small country, but even the health insurances have divisions of French-speaking, Dutch-speaking, and often German-speaking parts. And the decisions of the health insurances are then also taken per province. So if you, for example, I'm in Brussels, and I work mainly in Flanders, but then in Flanders, the same insurance that is in Antwerp and in Leuven and in Ghent, they have 3 different policies, and 2 of them reimburse, and even more than you said, Megan, they reimburse €200. And there is a cap on the maximum that you can reimburse, but it's not in the alternative healthcare. It's in what is called mental health care. So I put in the chat, in Belgium, yes, it is by prescription. So if, for example, my family doctor or my psychologist would write a prescription that supplementary to their treatment, it would be helpful that I get a mindfulness course. Then in Antwerp and in Leuven, I would get €200 reimbursement. And in the other provinces with the same health insurance, not. So it's very, very dependent. And why is that in this case? The people in Leuven we had the Leuven Mindfulness Center, so we were very close. We had dialogues all the time. And we invited them to look at the research we had, and they became convinced that it was a good business case. And also in Antwerp, they have a hospital where the psychiatrists, in part, offer mindfulness courses. So also there, they were informed about the research, and there was interaction. So that is a very good thing. Other than that, I would like to broaden, because what I hear is we are mainly talking about reimbursement from health insurances. So we are putting mindfulness into the therapy and medical realm. I never worked in that part, although I have a medical background. I never offered mindfulness in that part. What is much easier is to get employers to reimburse or even to pay full. I've given many courses at employers' premises, the employers offering lunch or even dinner, paying the full course, and it was in the time of the employer. And I, as a teacher, made the multiple of what a teacher makes who is in a hospital or in a psychologist practice. So I think we must open our windows to see where is it easier for people who need mindfulness to get it? Is it because their health provider helps them or because their employer helps them? And very often, that might be a better pathway to convince employers and even employer associations that it is actually a business case for them to help their employees to get this training. They could reduce burnout, they could reduce stress, they could increase well-being of their employees, they could reduce dropout because they go to another organization, and they could increase the time that people stay in a company and stay healthy to work. So I think that would be an avenue that, at least for me, has always been a better avenue to not talk about the money, but to get the job done and to make sure that everyone could participate, the youngest and the eldest.
Yeah,
That has mainly been in Belgium.
yeah, thank you, Katerina. But this is, I believe, in my felt sense, it is something that we all do as mindfulness teachers. So trying to find venues and contexts where we can offer our services as a prevention, actually, maybe more than when it's too late. When you are in the health system, it means something has already happened. Yeah, so I don't know, that's my feeling. I know, is there something else maybe that other members from Ireland wish to share before maybe close this meeting? Or welcome, Edwina. I don't know from where are you from, but welcome to the meeting.
I have a question, if that's okay. I'm just qualified, so I'm completely new to this and I hadn't heard of like reimbursement before, but I just wonder if that's the only avenue. Like, could you just work with the health service or something like that directly? Like, could they hire you to teach a full course rather than getting, I suppose, the participants to pay up front and getting partially reimbursed afterwards? I don't know. I'm just putting that question forward.
Bettini, please. Yeah.
Yeah, I mean, in Germany, the statutory healthcare systems, they actually have their own mindfulness teachers who are usually not MBSR teachers, or they are MBSR teachers and they teach adapted programs, but only digitally. So they have mostly they have their own apps and they have their own online programs, and people who are insured, who have their insurance there at this health insurance company, they get the courses for free. Basically, they're covered by their monthly payment. Yeah.
I can see that. Yeah. Thank you.
Yeah.
Yeah, thank you, Bettini. Dalida, you have a question,
Well,
please.
I have a comment on that actually. I don't have experience in Europe, but I have in China. And although there were hospitals that wanted services, for example, for also to be engaged in preventative support for their patients, there was a law, and maybe that's something to check, that non-medical staff could not be engaged in the hospital.
Mm-hmm.
So I think that's something maybe to check what is the law in each country.
Thank you.
I mean, in Germany, what more and more is present is that, for instance, medical people like doctors who are employed at hospitals do MBSR courses in the hospitals for patients who currently stay there. They're mindfulness courses, but not MBSR courses. But some are also these 8-week MBSR courses where then ex-patients come back to this doctor and do the course there. But I actually have no idea how it is reimbursed. So who's actually paying for this? If the client is paying all the insurance? Yeah, no idea.
Probably the doctor is in his job anyway, so it becomes part of his working hours. I guess I'm just guessing. Yeah, it's just like he's an employee. He works, I don't know, 40 hours per week, and within those 40 hours there is
Yes, something like that. Yeah.
That's probably, it's also how.
Find out, but I need to find out. Yeah.
Yeah, this is, I think, a bit unofficially happening a bit everywhere. As I said, even here in a country like Portugal, where there is no regulation whatsoever. But yeah, Katerina, you wanted to say something. You had your hand.
Well, it's
Yes.
in that same topic that you were asking about, whether there are insurances offering mindfulness training. And in Belgium, there are. So some offer, and they do engage properly trained MBSR or MBCT teachers. So it's not their own problem. They really select them very well. And the selection processes are also quite, they're good selection processes. but then they pay the teacher 120 euro per participant. And to give you a range, like a more normal price when a teacher organizes her or his training, it would be between 300 and 400. But in exchange, the insurance will also organize everything, like offer the venue, do the printing, all the things that the teacher otherwise has to organize. But I mean, it's about a third of what a teacher would get otherwise. So the power of insurances is also the power of your purse. But at least, I mean, I think it's a good start that they do at least do it, because it's also a symbol of recognition.
Thank you, Katharina. So we're getting closer to the end of this meeting. So I would like to again open the space, and is there something you're harvesting from all this conversation? What is maybe the highlight for you, what you can take forward into your country or into your association as a food for discussion, reflection, how to be proactive in a certain direction so that there is space for this, Ireland and whoever. Yeah, please, Satini.
Yeah, I mean, I already reached out to Günther, and I would like to, just record a small interview asking him how it all started and how he became so successful with this. And of course, now it's another time. And what is really inspiring me personally is to offer mindfulness courses over here in Germany to bridge the waiting times for people who are on long waiting lists to receive therapy and help. Because also here in Germany, more and more people are so much suffering from anxiety, depression, and other things, especially young people. And yeah, I will take that to our next German board meeting. Yeah, thank you.
Thank you, Tatini. Sarah, you have unmuted. Yeah, please.
Yeah, thank you so much. I'm taking a lot away from this conversation. We had looked into social prescribing as well, so that's great that Susan, you shared your experience. And I just wondered as well if you would share your case study if when it's available to share, because maybe that's something that we could use as well in taking our case. We're pursuing loads of different, which has come up here, from the workplace to kind of public health system and the prescription system. So working with we have an Irish kind of it's called the ICGP of general practitioners, so a membership for all doctors, like community doctors, and there's drop down menus basically with a selection of options. So it's trying to get into that selection where there's already other initiatives as well that have managed to get into that drop down menu, as a referral tool, as a prescription tool, and then there's different avenues for social prescribing, and there's different funding streams as well. So it's interesting that some of the drop down options have more funding behind them than, for example, social prescribing at the moment in Ireland. So it's just charting all the different waters in that respect. And the workplace piece as well. And there's a real shift in Ireland with large employers moving to EAP programs, employee assistance programs, which are outsourced, and then they have their own kind of mindfulness piece within those programs. So there's also those providers as well, which is another option for getting exposure within workplaces as well. So there's loads here, and it would be lovely to speak further with some people if there's a way of maybe through the board of getting some contact details of people to follow up on conversations about this, so that if people are working towards similar outcomes, that we could share resources like Tatini's shared brilliant resources there. It would be really cool to get Susan's case study and anything, and that we could share anything as well, and summaries of research as well that people are pulling together, because I'm sure a lot of us are drawing on the same meta-analysis and different clinical trials and stuff like that to make our evidence case for policy and decision makers. So it's really, really helpful to have this discussion. So thanks so much.
Yeah, thank you so much. So I pass it to Katerina. I have to go soon. I have a group of practice at past. So from my side, I thank you everybody for your generosity, for your sharing your wisdom, for sharing your time to start with. That's a big dana, generosity, practice of generosity. So please, Katerina, if you wish and to close this meeting. I will go, and thank you so much for your presence again and for your dedication and commitment to mindfulness. Thank you so much.
Bye, Teresa. Let's just hear from everyone here. We are a small group. What else you take away? We have words from Tatini and Sarah Jane. I won't call out names, but if you would like to speak up and tell us what you're taking. Yes, Hilary, please.
Yeah, I'm a bit nervous speaking because my internet is very unstable, so I just hope everybody can hear me.
Yes.
But no, I think this has been a really, really rich your programs, and like what I find, I'm not sure if it's the same thing, the social, oh, Susan was talking about the social, is that the same as the ETB programs here in Ireland, you know? Social prescribing, yes, yes. I would teach a good lot of social prescribing, therefore programs. They fill up straight away because they're free, you know, and in many ways it's great to, you know, help people, you know, really experience mindfulness and the benefits of mindfulness and that as well. And other free programs that I give is, you know, and I'm really, really privileged to do it, is working with cancer societies as well, you know, to help patients and their families through mindfulness. And there's one common thing that people say all the time, and I'm sure you guys hear it all the time, from your groups and the participants, they always say, and it's always with their hand on their heart, they say mindfulness should be taught to everybody. Everybody should learn mindfulness, you know. But then you know, like I did the master's in UCC in mindfulness-based well-being, and then I went down and I did mindfulness in the workplace, and I trained in Oxford as well. So I kind of feel, God, you know, I've done all of this training, and I go to workplaces and senior leaders, senior management, I just get a blank vacant look, because they don't see mindfulness as something that can increase profit margins. They don't get that, like somebody mentioned earlier on, that you know, the staff retention, you know, can reduce staff absenteeism and all of those benefits that we know. And it can be a lonely road that you can feel like giving up on sometimes, that you feel like you're banging on doors and nobody's hearing you or nobody cares. So this meeting has been great, that I feel that others are experiencing similar things, but also like I think what Tatiana said, it was a case of I was in the right place at the right time, having the right conversations. And I think that that's unity and kind of staying on the same page together, you know, almost like one voice, is really, really important. So as we feel, oh gosh, I'm not the only one, and we have somewhere to share ideas with each other and bounce off ideas. So that's why this has been great. Thank you.
Thank you. Excellent. Yeah. Anyone else who would like to share her or his takeaway, or whatever, if you have a question that we can take with us and reflect upon?
I didn't realize that the MTAI in Ireland was actually so involved in this. I saw it on the AMBA, I think, website. I don't know how you pronounce that, but I think what I'm taking away is just like how much there's going on around this issue in Ireland, and like that's really motivating me, I guess, because it's something I'm really passionate about. So yeah, just wanted to share that. Thank you.
Great. This is what happens often. People find the Yamba and the Yamba exchange meetings, and then they found out just around the corner there is an association in my territory. Let's become a member. So that is really great. Yes, I have a suggestion that together with Tatini and Sarah Jane, preparing a text to invite people to come into a working group, like all over the 34 Ayamba associations, and found a working group to find out what is going on in the different countries. Because that would be a real Ayamba project, looking at the different stakeholders, not only the teachers who provide it, but also the people who need it and can't get it because the reimbursement is so difficult, and then find stepping stones and explore whether the solutions found in the different territories could work. It could be one big experiment. And if we had a text to put that on the Yamba website and then put it in the next newsletter, we could get that project started. And then maybe for the next time, Eric Lukes, who wanted to be here tonight, a director of Brown University, would also participate in that. And we would get it from all over to find out what can we do to be of service to the teachers and to the people who know. I see you nodding, Sarah. Oh, Tatini also nodding. So can I invite you to prepare such a text? Then my part will be to put it on the website.
You mean like an invitation, Katerina, for people to contribute?
Just a short text to explain the objectives of the project and to invite people to come to a first meeting. And then we can add this recording to that post and we can take it from there. This has been a valuable start, more valuable than the bigger gatherings we had on this, because it has been very specific. We have talked about the problems that teachers have very often, that they can't fill the courses. But today we listened to more. We also looked at the people who are not able to access mindfulness-based courses because it is so difficult to get them without reimbursement. So it's a wider scope. So we can take that from here and play it by email or WhatsApp or whatever, or phone call. For now, I would love to, oops, there is, you shared that in the total. Yeah.
I know I can't, yeah, I know.
Okay. For now, allow me to thank all of you. It's been lovely to be able to see everyone on one screen. It looks like sometimes we want many people, but sometimes the essence and the quality is in a smaller group. So thank you very much for the active sharing and for the valuable food for thought. Also, I learned many things, and especially the part where, as you, Hilary, said, this prescription and the getting the waiting list, when we can help people who make a start and just fall in love with mindfulness, and maybe then they find a way to get it without us only being active. See you back. And the first we would like to see you again is at the Yamba Festival. So the Yamba Festival is coming up on the 20th of September, and it will be about trauma-informed mindfulness, but especially the collective healing with the concept of Ubuntu. The concept of Ubuntu is based on the fact that there is a collective helping the individual to heal. So getting away from the personal blaming and the personal healing to a collective healing. It will be a wonderful meeting because we have the people from three continents participating and contributing. So really, from the bottom of my heart, invite you to come there. Have a wonderful evening. See you soon.
Thank you. Bye.
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 Good evening.
See you.